Hello, good evening, doctors. Welcome to the Weekend Wisdom Short. So, let us continue with the magnesium sulfate. So, what we have discussed in the magnesium sulfate previously, let us just quickly recap. So, this is the drug of choice for the pre-eclampsia and eclampsia, sorry. And what is the mechanism of action? It blocks the neuronal calcium influx, and we have already discussed about how to load the magnesium sulfate for Pritchard regimen, the loading dose. As we have already discussed, those who have not followed the previous class, you can go to this link in the description box, and in the YouTube you can find the previous class. So, what are the things we are going to have in the eclampsia kit? That is 14 ampoules of magnesium sulfate, and for which 4 IV, 5 IM, and 5 IM for the other buttock, and a 20 cc syringe and two 10 cc syringes we are going to take it. Okay, so now how we are going to monitor the case with a patient having a preeclampsia or eclampsia, and now she is on magnesium sulfate, because magnesium sulfate might cause toxicity if it crosses at set of levels. Okay, so we have to monitor the vitals, that is pulse, blood pressure, respiratory rate, and saturations every 10 to 30 minutes based on the condition of the patient. Then we have to record the deep tendon reflexes. So this point is very important, that the deep tendon reflexes have to be measured. Okay, based on this we can know if the patient is landing up in the toxicity or not, and we can look for any complaints of headache, epigastric pain, any visual disturbances also we have to look for. And we have to monitor the input output record. Okay, input output record, and check for the fetal well-being. So, what are the benefits of magnesium sulfate? Why it is considered as a drug of choice? Because it controls the fits or seizures very effectively without any depression effect to the mother or the infant. Okay, there are no depression effects unlike the diazepam or lorazepam. If you give, the mother or the baby might land up into the respiratory depression or something else. But in the magnesium sulfate, it does not have any depression effect, and a reduced risk of recurrent convulsions can be seen, and there is a significant reduced maternal death rate, that is to 3%, and a reduced perinatal mortality rate. So, what are the therapeutic level of serum magnesium? The therapeutic level of serum magnesium is 4 to 7 milliequivalents per liter. Okay, and in some selected cases, the magnesium levels should be monitored in cases of any renal insufficiency or in cases of any deep tendon reflex absency. So every 4 hours you will check the deep tendon reflexes. If the deep tendon reflexes are absent, then immediately you have to go for the serum magnesium levels. So the optimum serum magnesium levels to stop the fits is 4 to 7. Okay, remember this, 4 to 7 should be the optimum levels, that is the therapeutic level. If it is more than 7, slowly the first to lose is the deep tendon reflexes. Okay, the first sign of magnesium toxicity is loss of deep tendon reflexes. Then if it is more than 10, then you will have a respiratory depression. More than 10, it is a respiratory depression, and more than 25, it is the cardiac arrest. Okay, so that is the reason you have to monitor very carefully for the magnesium toxicity. So, yes, once again, the monitoring of magnesium toxicity, the first thing to come is loss of deep tendon reflexes, then decreased respiratory rate, and decreased urine output. So, every time you have to monitor the urine output before emptying. So, if it is less than 30 ml per hour, you have to quickly or carefully look for the magnesium toxicity, or in cases of any chest pain or heart block also you have to look for. So, how to manage the magnesium toxicity? First, immediately stop the magnesium therapy. Excuse me. Immediately stop the magnesium therapy. Then estimate the serum magnesium and creatinine levels, because the renal failure might land up or set in. So, creatinine level also you have to check for. And the proper treatment is calcium gluconate. So, the injection of calcium gluconate, 10 ml 10% solution, 10 ml 10% solution, IV in 10 minutes you have to give. Okay, the injection calcium gluconate 10 ml. Okay, the 10 ml of 10% calcium gluconate IV over 10 minutes. Okay, this is a tens in calcium gluconate. That is, in magnesium toxicity, you have to give 10 ml of 10% calcium gluconate IV in 10 minutes. So this is the management of magnesium toxicity. I hope you have liked the class. So this is all about the magnesium sulfate you have to learn. So be cautious when giving the magnesium sulfate, and be cautious how to load the magnesium sulfate, and how to and keep in hand the calcium gluconate also. Okay, so I hope you liked the class. Let us discuss some more interesting topics in the coming weekend wisdom short. So if you want any topic to be discussed in the weekend wisdom short or free Friday master class, you can happily ping us so that we can work it on it and make easy for you. Okay, thank you.